All right. Hello. It looks like we are on Facebook Live here. I'm Margaret Heaton-Ashby. Oh, don't touch the mic. I'm Margaret Heaton-Ashby with Nevada Advanced Pain Specialists. I'm the marriage and family therapist here. And I'm here to check in with you today because May is Mental Health Awareness Month. And so we here at Nevada Advanced Pain wanted to say we recognize the interplay between chronic pain and mental health. So I'm here to share some information with you regarding that, talk about some statistics, and then provide you with some tips as well as discussing a couple common mental health conditions. So to get started, there are several ways that chronic pain and mental health conditions are connected. Both actually interfere with everyday life. Chronic pain can certainly affect your day-to-day life with interfering in work and home functionings. And it can also make it difficult to participate in social activities. The other thing that's a really common experience for people living with chronic pain is having sleep disturbances, fatigue, trouble concentrating, decreased appetite, and mood changes. A lot of those are also experienced in mental health conditions. And so with these negative lifestyle changes, it's often the experience that they will increase your pain and can dampen your overall mood. So it's not surprising that chronic pain can result in depression and anxiety. So a couple statistics. According to the CDC, 50 million US adults have chronic pain. 50 million. And 20 million have the type of pain that's so intense and persistent that it interferes with life, work on a nearly daily basis. So you're not alone in having chronic pain. I think that's something really important to acknowledge with this statistic. 50 million to 20 million people. Mental Health America also conducted their own survey between 2015 to 2019, where they had 161,000 participants or more complete their free online survey. And from that survey, they found some interesting information. What they concluded is that 79% of people with arthritis or other chronic pain were screened positive, I should say, for a mental health condition. That's a fairly large population. With chronic pain, they also found that those who already had established mental health conditions, chronic pain was linked to worsened symptoms of mental health, specifically for individuals struggling with anxiety, bipolar disorder, depression, and PTSD. The other interesting piece of information that came from this survey from Mental Health America is that those people who experienced chronic pain, there were a number of groups of individuals experiencing chronic pain, not just older adults that we typically talk about. So veterans and active duty military, caregivers, and trauma survivors were also in that population group tending to experience more chronic pain. In a nutshell, people with chronic pain are 4 times more likely to have depression or anxiety than those who are pain-free. So if you are experiencing chronic pain and you are noticing impacts on your mood, you're not alone. There's certainly a correlation between the two. And these statistics show that physical pain and emotional pain often go hand in hand. And that is why Dr. Patterson has developed his practice around the biopsychosocial model. He definitely understands the impact and interplay between chronic pain and mental health. It's also important to note that chronic pain not only can trigger anxiety and depression, but it also increases your risk for substance abuse and suicide. And treating your mental health can sometimes actually help with chronic pain as well. So we here at Nevada Advanced Pain want to work to break the stigma with mental health. And we are open to talking with you about any concerns you may have. So please reach out to us and talk to your provider if you can relate to what I've shared at this point. But I'd actually like to take a minute to look a little bit further at some of our mental health conditions that we talk about here. Depression, anxiety. It seems as though in our society we throw around these terms, but we don't really look at what they mean. And so I want to take a few minutes to talk about what they mean. So if we start off with depression, Depression is a mood disorder that consists of persistent feelings of sadness or loss of interest. And persistent means it's not just having a day or two where you're feeling down or blue. It's a persistent experience that you have for at least 2 weeks, and it can last for months. Depression affects the way you think, the way you feel, and the way you behave. And you may find that you have trouble in your normal day-to-day activities. You may even feel that life isn't worth living. That doesn't have to be the case, but it can be a part of the experience with depression for some people. Other symptoms that are connected with depression include feelings of sadness, tearfulness, emptiness, and hopelessness, angry outbursts, irritability, frustration, even over small matters. Loss of interest or pleasure is often experienced as well, and this loss of interest is in normal activities such as sex, hobbies, sports. Another common experience or symptom of depression is sleep disturbance. Sleep disturbance typically happens on a spectrum of sorts. One end is insomnia, not getting much sleep at all, or hypersomnia, sleeping too much. Depression can also integrate or have the symptom of tiredness and lack of energy, so that even small tasks take effort. Reduced appetite is common, so changes in appetite. So you might find that you really don't have an appetite and you are forcing yourself to eat or just not eating. And then of course having some weight loss, or on the other side, you're eating too much. You're having some intense cravings and actually some weight gain possibly. Anxiety, agitation, and restlessness also can go with depression, as well as, or on the opposite side, slowed thinking, slow speaking, slowed body movements. Again, that fatigue piece sets in. Trouble thinking, concentrating, making decisions also go along with depression, as well as feelings of worthlessness or guilt, or fixating on past failures. And of course, as people commonly think, depression is categorized by feeling suicidal. That is a part of depression and certainly can be a symptom of depression. So recurrent thoughts of death, suicidal thoughts, suicidal attempts can be a part of depression as well. Unexplained physical problems can be a part of depression. So back pains and headaches can go along with it. The other thing I want to take a minute to note with depression is there are contributing factors to depression. Sometimes there's genetic or biological factors. Other times there is illness that can be a contributing factor. And so since we are here at Nevada Advanced Pain working with clients with a number of serious or chronic illnesses, it's important to take note what role they can play as well. So things like cancer, stroke, heart disease, chronic pain, all can contribute to depression, as well as certain medications can contribute to depression. So, as I mentioned a minute ago, depression can cause noticeable problems in day-to-day activities. Work, school, social activities, relationships can all be impacted. And you may have a general sense of feeling miserable or unhappy without really knowing why. So that's depression dissected. If you can relate to any of those, please reach out to your provider and talk with them about that. You don't have to have all the symptoms, but you might have a handful and they might be interfering with your life. And so it helps to reach out and talk about them. The next category of mental health conditions I'm going to talk about real quick is anxiety. There are a number of anxiety conditions, but if we just focus on general anxiety, the symptoms that go along with that include a persistent worry or anxiety about a number of areas. And persistent is important. We all have times in life where it's stressful and our anxiety goes up, our stress levels go up, and we feel these symptoms that I'm going to list off. But the part where it becomes more of a mental health condition is when it's lasting for an extended period of time, up to 6 months or longer, and these worries are present for more days than not. Continued symptoms with anxiety include the inability to set aside or let go of worry, overthinking plans and solutions, trying to come up with solutions to all possible outcomes, especially worst case scenario outcomes. Indecisiveness, fear of making the wrong decision, inability to relax. I commonly hear that one with people who are struggling with anxiety. That feeling of restlessness, keyed up, on edge. Difficulty concentrating also goes along with anxiety, or that feeling of your mind going blank. And so these are some cognitive, some thinking symptoms associated with anxiety. Anxiety also has physical symptoms that go along with it. Not surprisingly, if you think about being keyed up or on edge, there is that physical symptom of feeling fatigued, trouble sleeping, muscle tension or muscle aches, trembly, twitchy, that antsy leg that keeps shaking, nervousness or being easily startled, sweating, nausea, diarrhea, irritable bowel, all physical symptoms that can go along with anxiety, as well as, of course, irritability. And so again, just like with depression, these symptoms associated with anxiety can create significant distress in your life and in all aspects of your life, your social, your work, your relationships. And the last thing with anxiety that I want to note is that there may be times when your worries don't completely consume you. However, you may still find yourself feeling anxious for no apparent reason. And so some examples that I will hear are feeling this worry about your safety, or worry about safety of your loved ones, or perhaps just having a general sense that something bad is about to happen. So that's anxiety. We talked about depression, we talked about anxiety. These are more than just a couple days. These are things that are going on for quite a while. And if you've been living with chronic pain, you probably have experienced some of these symptoms. So the good thing to note is that generalized anxiety disorders and depression and most mental health conditions are improved with psychotherapy and or medications. They're improved with making lifestyle changes, learning coping skills, and using relaxation techniques. So, since you've bared with me for this long, I am going to talk about a few tips to help with this. The first tip, we've heard it time and time again, engage in physical activity. And so with that physical activity, sometimes it's like hearing nails on a chalkboard, and I understand that, especially when you're living with chronic pain. But I think our expectations around physical activity or exercise may need to change, because our abilities, our phase of life have all changed. And so perhaps exercise now for you is taking a short walk, or practicing Tai Chi, doing chair yoga, or even bed yoga. And so YouTube is a great resource for accessing Tai Chi, chair yoga, bed yoga. Check it out, it's pretty cool stuff. Another tip for both addressing chronic pain and mental health is reducing stress. Now, we can't escape life. Life is stressful, but we don't have to create more stress for ourselves, and we can learn some relaxation tips to help us relax. So some very common, very easy stress reduction techniques are diaphragmatic breathing, progressive muscle relaxation, and guided imagery. Diaphragmatic breathing is important because it counteracts that anxiety breath. The anxiety is the shoulders. The diaphragmatic breathing comes from the belly. The belly expands as you inhale and then contracts as you exhale. And our next episode or edition of Active Nevada will actually be focused on diaphragmatic breathing. So stay tuned. You can either check out the magazine or check out our website for more information on diaphragmatic breathing with regards to mental health, as well as from a physical therapy perspective. Also, we are coming out with a mental health workbook. And in this mental health workbook are breakdowns of how to do progressive muscle relaxation, guided imagery, diaphragmatic breathing, even some mindfulness exercises that we'll talk about in a second. So YouTube also is a good place to access these resources. With stress reduction, don't forget to laugh. When we're in pain, when we are stressed out, when we're depressed, we don't laugh. So sometimes laughter is the best medicine after all. As well as taking advantage of our weather. It's very common for our moods to change with the weather, stress levels to change with the weather. So get out and enjoy the sunshine while it's here. If you can't enjoy the sunshine like you used to, again, we can modify. Maybe it's just sitting outside in the morning with a cup of coffee, or enjoying it in the evening as the sun goes down. But fresh air and sunshine is wonderful. Another tip is developing realistic expectations. When we are dealing with chronic pain and mental health conditions, our expectations sometimes are no longer fitting what we are able to do. And so we have to really challenge those and take a look at them. I will share with you, in our current edition of Active Nevada, there is an article on developing realistic expectations and the impact it has with both chronic pain and mental health conditions. Perfectionism is a challenge for a lot of people and creates both complications with mental health and chronic pain. 2 more tips. Staying connected. Staying connected is huge. Oftentimes with chronic pain, I hear people say they tend to isolate themselves. And I understand where they're coming from with that. And I also know it's not helpful. We are wired for connection as human beings. And so we create more pain when we are isolating ourselves, and we create more mental health conditions. So find 1 or 2 special people that you can connect with and make that effort to stay connected. Lastly, we have mindfulness and meditation. Research shows again and again that mindfulness and meditation reduce anxiety, they reduce pain levels, and they help with depression. So if you are interested in mindfulness and meditation, you can tune into our mental health workbook, which is on its way. So hopefully some of this information has been helpful. If you can relate to any of it, please, first and foremost, reach out to a close friend or a loved one, contact your minister or spiritual leader, and if needed, you can reach out to the suicide hotline. The suicide hotline number is 1-800-273-TALK. That's 1-800-273-8255. And of course, please reach out to us here at Nevada Advanced Pain. Your provider is more than happy to talk with you about any symptoms you might be experiencing, or even a primary care provider. So, my last note for you is, please don't wait until your symptoms become unbearable. Just like with any medical condition, the sooner you can get help, the easier it is to treat. If you have found this information today helpful and or would like to talk further, please feel free to reach out to us. You can reach us on the web with, our web address is nvadvancedpain.com, or our phone number is 775-284-8650. All right, take good care of yourself. Thank you.